Hello beautiful people, welcome back to my channel once again with your part 4 of biochemistry practice MCQs. Hope you are liking my part 1, part 2 and part 3 of biochemistry practice MCQs. So please do like, share and subscribe to my channel. Keep supporting me. And today let's start with our part 3 MCQs. Let's get started with our today's video. So our 46th question is a blood gas sample was sent to the lab on ice and a bubble was present in the syringe. The blood had been exposed to room air for at least 30 minutes. The following change in blood gases will occur. So this is a kind of case study, friends, regarding acid, that is regarding on blood gases. So your option A, CO2 content increased or PCO2 decreased. Option B, CO2 content and PCO2 increased or pH decrease. Option C, CO2 content and PCO2 decrease / pH decrease. Option D, PO2 increased or HCO3 decrease. So here they are asking that a blood sample was sent to a lab on ice and a bubble was present in the syringe and the blood has been exposed to the air for 30 minutes. So what are the following change in the blood gases will occur? So here the right option is PO2 will be increase and HCO3 will be decrease. Okay, moving on to our 47th question. The following laboratory results were obtained. Here, this is also a kind of your case history question type. And here they are asking about the serum electrolytes value. They have given sodium is 136 MEq per L, potassium is 4.4 MEq per L, chloride is 92 MEq per L, and bicarbonate is 40 MEq per L. And they are also given the arterial blood measurements, that is pH is 7.32 and PCO2 is 79 mmHg. These results are most compatible with what? Option A, respiratory alkalosis. Option B, respiratory acidosis. Option C, metabolic alkalosis. And option D, metabolic acidosis. So the right answer with these case history is answer B. This is respiratory acidosis. Moving on to our 48th question. Osmolar gap is the difference between option A, the ideal and the real osmolality values. Option B, calculated and measured osmolality values. Option C, plasma and water osmolality values. And option D, molality and molarity at 4 degrees centigrade. So the right answer is option B, calculated and measured osmolality values. Moving on to our 49th question. The most important buffer pair in plasma is option A, phosphate or biphosphate pair. Option B, hemoglobin or imidazole pair. Option C, bicarbonate or carbonic acid pair. Option D, sulfate or bisulfate pair. So the most important buffer pair in the plasma is option C, bicarbonate or carbonic acid pair. Moving on to our 50th question. Most of the carbon dioxide present in blood is in the form of CO2 present in the blood is in the form of what? Option A, dissolved CO2. Option B, carbonate. Option C, bicarbonate ion. And option D, carbonic acid. So friends, the right answer is answer C, bicarbonate ion. Moving on to a 51 question. Serum anion gap is increased in patient with option A, renal tubular acidosis. Option B, diabetic alkalosis. Option C, metabolic acidosis due to the diarrhea. And option D, lactic acidosis. So the right answer is answer D, that is lactic acidosis. Moving to our 52nd question. The buffering capacity of blood is maintained by a reversible exchange process between carbonate and what? Option A, sodium. Option B, potassium. Option C, calcium. And option D, chloride. So the right answer is answer D, chloride. In between the exchange process in between bicarbonate and option D, chloride. Moving on to our 53rd question. Which of the following electrolytes is the chief plasma cation whose main function in maintaining the osmotic pressure? Option A, chloride. Option B, calcium. Option C, potassium. And option D, sodium. So the right answer is answer D, sodium is the chief plasma cation whose main function is maintaining the osmotic pressure. Moving on to our 54th question. A potassium level of 6.8 MEq per L is obtained. Before reporting the results, the first step of the technologist should take is option A, check the serum for hemolysis, option B, rerun the test, option C, check the age of the patient, and option D, do nothing, simply report out the result. So the right answer is check the serum for hemolysis so that they should not get hemolyzed. Okay, moving on to 55th question. Calcium concentration in the serum is regulated by option A, insulin, option B, parathyroid hormone, option C, thyroxine, and option D, vitamin C. So the right answer is option B, parathyroid hormone is uh, is the calcium concentration in the serum is regulated by option B, parathyroid hormone itself. 56th question. The regulation of calcium and phosphorus metabolism is accomplished by which of the following glands? Option A, thyroid, option B, parathyroid, option C, adrenal glands, and option D, pituitary glands. So the right answer is answer B, parathyroid gland. Moving on to 57th question. This is also a kind of case history question. A patient has the following result, that is increased serum calcium levels, decreased serum phosphate levels, and increased levels of parathyroid hormone. So this is the condition of the patient. So the patient is most likely to have what? Option A, hyperparathyroidism, option B, hypoparathyroidism, option C, nephrosis, and option D, steatoria. So the right answer is answer A, hyperparathyroidism. So the patient having this kind of condition is most likely to have option A, hyperparathyroidism. Moving on to 58th question. A hospitalized patient is experiencing increased neuromuscular irritability, that is tetany. Which of the following tests should be ordered immediately? Option A, calcium, option B, phosphate, option C, B1, that is blood urea nitrogen, and option D, glucose. So the answer is answer A, that is calcium. Moving on to 59th question. Which of the following is most likely to be ordered in addition to serum calcium to determine the cause of tetany? Option A, magnesium, option B, phosphate, option C, sodium, and option D, vitamin D. So the right answer is option A, magnesium. Okay, moving on to our 60th question. A low concentration of serum phosphorus is commonly found in option A, patient who are receiving carbohydrate hyperalimentation, option B, chronic renal disease, option C, hypothyroidism, and option D, patient with pituitary tumor. So the right answer is answer A, patients who are receiving carbohydrate hyperalimentation. Okay friends, so these are your part 4 biochemistry MCQs, that is practice MCQs for your Prometric examination. Hope you like it. Keep supporting me. Do like, share, and subscribe to my channel. See you soon with my next another video. Until then, take care. Keep supporting me. Thank you, friends.